Hey guys, welcome to Medten. So in this video we are going to look at iron deficiency anemia in detail. Okay, first of all, what you need to know is iron deficiency anemia is the most common nutritional disorder in the whole world. Okay, it's the most common nutritional disorder in the world. Okay, it's how does it mainly act in our body? It acts by due to inadequate hemoglobin synthesis. Inadequate hemoglobin synthesis. Okay, this is why when the hemoglobin synthesis is inadequate, it results in anemia, and that is due to the deficiency of iron and resulting in iron deficiency anemia. So let's move on to the basics. Okay, first we'll understand how is the iron distributed in our body. Understanding this topic is very important, so we'll be looking at iron distribution in the body. Okay, firstly, the iron distribution in the body is different from men and women. Okay, women have a lesser content of iron in their body. Okay, first of all, total iron. How much is the total iron in men? In men, it is approximately 3450 mgs, and in women, it is also approximately 2450 mgs. Okay, this is the total iron in men and women. Now, this iron can be functional. Functional meaning it has already been incorporated in the body and is acting. How can it be functional? When it is acting through the hemoglobin. So how much is hemoglobin in man? In around 2100 mg of iron is in the form of functional hemoglobin, and in women it is 1750 mg. Moving on to after hemoglobin, the next functional iron containing is myoglobin. Myoglobin is approximately 300 mg in men, and it is 250 mg in women. And after myoglobin we have certain enzymes, and what are these enzymes? We have the catalase, cytochrome. Okay, these all enzymes, they contain iron in them. And how much does it contain throughout the body? It is 50 mg in both men and women. Now after this functional iron we have a storage iron. Okay, when after all the functional iron we have some storage left in the body, and this storage is in the form of ferritin and hemosiderin. Okay, ferritin and hemosiderin. And how much is the quantity? In men almost 1000 mg is stored, and in women it is only 400 mg. Now you'll ask me why only 400 mg. This is because they lose most of it during menstruation. Every month due to menstruation they lose a lot of blood, and in that they lose a lot of iron, due to which women have a lower content of iron in their body. So this is the iron deficiency anemia, iron distribution in the body, and this is according to Robbins textbook of pathology. This is how the distribution of iron is in the body of men and women. Now after this distribution, first we'll look at how about the daily excretion. So we have iron in our body. How is it excreted? Is it excreted through the renals, through the liver? What is it? So one thing you have to remember is that there is no regulatory pathway. There is no regulatory pathway for the excretion of iron. Okay, there is no regulatory pathway for the excretion of iron. So how much is the daily excretion of the iron? It's only 1 to 2 mg. 1 to 2 mg per day is the daily iron excretion. Okay, and how does this occur? This occurs through the shedding of mucosal and skin epithelial cells. What mucosal, what epithelial cells? Mucosal nothing but as the intestinal mucosa. That is nothing but as the duodenal mucosa. Okay, this is how the shedding occurs. Now moving on to the daily absorption of iron. How much is the daily absorption of iron? Okay, now a normal adult is living in either in anywhere part of the world, he will take adequately the consumption of iron is between 10 to 20 mg. Okay, now you will ask me that when the daily excretion is only 1 to 2 mg and when the intake is 10 to 20 mg per day, then there should be no iron deficiency anemia. Well, however, how much are adequately consumed? Out of this, only 5 to 10% is absorbed in the body. 5 to 10% is absorbed in the body. In the body, how is it absorbed? So basically we have two types of iron. We have something called as the non-heme iron, and then we have the heme iron. What is it, non-heme iron and heme iron? So basically heme iron is nothing but the iron content that is directly coming from the destruction of hemoglobin. So you know that the RBCs will be broken down in the spleen and other areas side, right? And whenever they are broken down, that hemoglobin is also broken down, resulting into heme, and whatever the iron that the body gets from the heme, that is called as the heme iron. So what about the non-heme iron? Non-heme iron is nothing but the iron that we take from the food. So that is the non-heme iron. So the body can identify heme iron and non-heme iron, and whenever there is heme iron, it will absorb almost 10 to 20% of all the heme iron. Suppose I have 100 iron which are broken down in the body from the hemoglobin. Out of this, 20 iron will be absorbed in the body and 80% of will be thrown out. Now compared to non-heme iron, if I am taking 100 iron as an intake of diet, it will only absorb 5 to 10% of it. So only 5 to 10% of non-heme iron is absorbed and 10 to 20% of heme iron is absorbed. So this is the reason. Now you know that, right? When there is adequate intake of 10 to 20 mg per day of iron and there is only excretion of 1 to 2 mg per day, there should be no deficiency. But actually, out of this 10 to 20 mg, if you consider 5 to 10%, it will only be 1 to 2 mg. 1 to 2 mg. Now you are asking that when the adequate absorption is only 1 to 2 mg and loss is also 1 to 2 mg, there should be no deficiency. Well, I will tell you how the deficiency occurs. So this is the daily absorption of iron. Okay, 5 to 10% is absorbed in the body. Adequate intake is 10 to 20 mg. And how is it absorbed? Non-heme iron and heme iron. Heme iron is something iron that is coming from the destruction of hemoglobin, and non-heme iron is the iron that we take from the food. Okay, so daily intake and excretion is sufficient on a daily basis. Now we will see what happens in front.